Hi, Nursing 6839. Welcome to Primary Care 3 Diagnosis and Management 2. I am Dr. Kim Paxton and I will be your instructor for this course. This will be a continuation of knowledge attainment that you started with in Diagnosis and Management 1 last semester. First, to help you understand how this course is going to run, this course and each module of this course opens and starts on Monday 0001. And it ends on Sunday at 23:59 p.m. So the course runs over an entire week, and there are different elements that you will be asked to engage in throughout the week. And I'll be going over those in just a few minutes. If you have concerns or if life begins to happen for you within the course and you need extensions on coursework, please make sure you reach out to me. I'm pretty lenient in providing extensions because life really does happen around us, things you can't control, and important events of life that you really shouldn't miss out on. And this needs to be a supportive environment for you as a student, and I want to make sure that I'm able to provide that to you. The course topics that we'll be reviewing in Diagnosis and Management 2 are topics that you did not have an encounter with in Diagnosis and Management 1. Complex mental health issues, substance abuse, and chronic pain, you probably touched on a little bit in Diagnosis and Management 1, and in DM1, under that complex mental health title, that's where depression and anxiety come into play, but those are actually not considered complex. We're going to hit some of those more complicated neurotransmitter mediated type disease processes and help get you a little bit more fine tuned. You have several different types of assignments for this course. We have individual and we have what are known as CLTs. CLT is a collaborative learning team. Each of you has been placed as a member in a CLT group. You're able to find out what CLT group that you're in by going under your People tab, and it should be listed there for you. For your individual assignments, these are quite varied, and you can see them listed here on this screen. For the opioid training, I'm going to go into this a little bit more in depthly on its own individual slide. There are scattered throughout the course some quizzes. You will have 3 attempts to get maximum points on these, so have at it. There are five exams for the course, and they are listed. You will find them located with their dates and times on your calendar for the course. You will also find them on the syllabus page after the syllabus heading. For the exams, they open on a Thursday and they close on a Saturday. Now, this is open for us to navigate if we find as a course team that, you know what, this would really be better if we opened it on a Friday and we closed it on a Sunday. So we need to have dialogue about this if we're finding the Thursday, Saturday doesn't work. So we will continue to evolve with that as we progress in the course. I do have the dates up for you so you can plan accordingly. The varied individual assignments are exactly what they say. It could be an interactive game, it could be some type of an intense clinical reasoning matching, it could be map drawing, it could be finding elements and sharing different things, but they are something that are a little bit different and not quite so much writing. The PBLs, I believe that you are quite familiar with coming out of the Diagnosis and Management 1 course. They haven't changed in what the expectations are. It is the same template, it is the same rubric, so you don't have to worry about trying to learn something new. They are the same. The reflection paper is a little bit different, and again, you had one previously, but now we're looking at more where you're going, how you're heading, and how your thinking is beginning to change. So that paper, it's very self-explanatory, but allows you to have more of a creative edge to an assignment. I'll go over each of the CLT assignments individually. You're aware about what CLT discussions are. I will go into that more in depthly. You have one group assignment with your CLT. It's a clinical reasoning assignment, and there is an HIV group assignment when we get to HIV. It's very simple. It's not a complicated thing, and instead of doing this as a CLT group, you've been placed in HIV groups to do this. HIV is a complex disease, and the treatment process of it is a little bit complex. So we put you into different groups to work with. For the opioid training, this training occurs in Module 2. I do need you to get in there and register to take this before week number 2 or module number 2. There is a link at the top of the page. It says, for this assignment, you're asked to complete the online program. You have to go to that link to register for the class. Then the coordinators of the course will allow you access to the course 24 to 48 hours after you submit that. But you have to register first before you can enter into the course. This course is housed in Canvas, and you will get a link that'll take you to that. It takes about an hour to 2 hours to go through it, and then at the completion you will get CEs for it, and you will also get a certificate. I need you to screenshot your certificate and upload that certificate to the assignment submission link for this assignment. This is 25 points. It's not optional to do this. If you don't do it, it's 0 points. 25 points must be done. This opioid training is something that is being mandated down for academic institutions to do. You did not receive this type of training in your pharmacology class. The advanced practice nurse prescriber is really honing in on nurse practitioners coming out of education with a stronger base of understanding of how to prescribe opioids. So this will help you with that. If you have any questions, any concerns, or you need an extension because of life circumstance for this, you need to make sure you reach out to me and have a dialogue with me about it. The formatting of this class follows a very systematic approach, so every module is going to have the exact same formatting. The formatting of this course does mirror what you experienced in Diagnosis and Management 1, so there's a familiarity with you to how the course lays out so you don't have anxiety on where to find things. So each module is laid out exactly as you see it here on the screen. You're going to have your objectives and overview, your readings, media, and we are having a synchronized Zoom seminar, and I'll talk about that more in just a second. If there's a study guide associated with the module, that will be there. And then there's an assignments heading. Anything under this heading is something that you are required to do assignment-wise for the course. So for this first week, you have an introduction to do, and your first posting of this, of what your part is due on the 29th. There's a mental health quiz, and then we have a PBL for you to do. And then the following week, week 2, it follows the exact same format. Your objectives overview, your readings, and then your assignments. The objectives in the overview that you will find for this course are written in a very systematic way. You have what's the focus, what are my topics. If I need to provide you with clarifying items, things I want to make sure that you really understand, I'm going to put it under clarifying points for the course. One item you're always going to find is about APA formatting. I am a stickler for APA formatting. Those of you who have had me for health promotion and prevention know that I want you to follow APA formatting. With APA formatting, you will use this especially with any citing that you're going to do. So you would do an APA citation, your discussions if you use something to support your thoughts or you want to share something with your colleagues, cite it, and at the bottom write the reference in correct APA format. The module outcomes and what the expectations are for you to take away from this link back into the course outcomes. Checking for understanding. How do you know that you learned what you were supposed to learn for this week? Well, if you're able to answer these questions in a positive way, then you were able to learn those elements. And each week is set up this exact same way. Your module, readings, media, and Zoom seminar are set up as a page with the exact same information in the same place in every single page of every module. So the first thing you're going to see when you open this page up is that we have a synchronized seminar occurring on Wednesdays from 10 to 11 o'clock, and I've embedded your Zoom link right here. I will be posting right underneath the seminar any PowerPoint or any lecture type material that I would be having that I would use in the seminar so you can access it there. So for those of you who are going to join the seminar on Wednesdays, you will have that information. For those of you that can't join the seminar, I will upload the link for the Zoom recording that I'll be doing, and you'd be able to view that at another time. Your required readings are listed next, and for week number 1, you can see what they are. For the mental health information, we're going to be using the Duran book, which is what you started with in Diagnosis and Management 1. We're just going to expand upon it. In primary care, a lot of the care that we give does revolve around mental health. So we really do have a strong thread of this running throughout the primary care courses in the AG program. The next pieces that you're going to see after your required reading would be recommended reading. Now, the recommended are things that these would be really great. They may help you plant in more key elements of understanding related to our topics, but they also might be resources that you might want to download and put into a folder that you have for when you're out into practice as an easy reference. Videos will come next. Now, please be aware that if I have a video posted for you and the required readings, any information from these may be included in an examination. So I don't want you to feel blindsided. So information that's presented in a video or information that you should have learned from doing your readings will be included in exams. Recommended and supplemental information will not, because that's not a requirement for you to have to review and take knowledge translation from. For your CLT discussions, you are split up into your groups. You will be given instructions to begin with, and each discussion is a little bit different. They're not all the same, and they are varied. Of importance is that you will have questions related to whatever discussion is occurring that I do want you to answer. Please make sure that you are answering them thoroughly. Please don't answer, I agree with whatever the article was saying, and it's really important for nursing. That's not going to get you points. I want you to really show to me a professional discussion, like you were sitting in front of me and you and I were having this talk over a cup of coffee, and show your point. Support your points with references. Important for you to know is every single CLT discussion is going to be exactly the same with respect to when do you have to post your initial posting to, and when do you have to respond to 2 other members. It's exactly the same for every single discussion. So for every discussion that we have that's related to your CLT, you must post your initial response by Wednesday, and that Wednesday is 23:59 p.m. I should probably put that on these slides. You have to respond back minimally to 2 other individuals in your CLT by Sunday at 23:59 p.m. Now, for our discussions, I have really tried to hone in on some of the hot topics that are occurring in relationship to that subject matter. So, for instance, for our substance abuse week, it's marijuana. And you should walk away with a really strong understanding of marijuana, both of its medicinal effects, its adverse effects, the potential for addiction, and who's really at risk for having problems with these type of drugs. So I hope that you'll enjoy this particular discussion. If you have any questions about the discussion, don't hesitate. Just reach out to me and ask. The rubric in your grading for your discussions did not change from last semester. You see it here, you're familiar with it. Just wanted to make sure that you were aware one more time that points will be taken off if you don't post in a timely manner, so you don't post by Wednesday and you don't respond to 2 other members. There are spelling, grammar, and APA. I'm really more of that stickler for the APA. I know sometimes that our spelling can skip, or we could think we've got something right grammar-wise. So I'm not unless it's like really blatant and all over the place, I don't usually take points off. I may indicate, hey, just kind of watch out. We all make mistakes, and we all will learn from them. So I'm not going to be a real stickler, but the APA thing I am on. For your CLT group assignment, the clinical reasoning one, you will find that located at the top of the modules page under course resources. Entitling of this is Clinical Reasoning, CLT Recorded Case Presentation Instructions, and CLT Case Assignments. This assignment is a group assignment, and the instructions are very explicit. So click on that link and enter into the instructions. Now, this particular assignment is not due until towards the end of this semester. I believe it's either in week 10 or 11. But it does require quite a bit of work. So you guys need to work in your teams. How you choose to work in your teams is completely up to you. How you choose to share your documents and writing this is completely up to you. You can use Google Docs. You can use any other form you want. You can just email each other. It's up to you. If you want me to put up a conferencing link for you, I can do that here. There's also a collaborations link that is located on your left hand tab of the course that you can also use. This is completely up to you how you guys do this. So let's get into this. So every person, each team is randomly assigned. You guys know that already. Now each CLT group will have similar questions and similar amounts of questions that you will need to answer in relationship to this case study. But they're not the same types of cases, so the questions are not always the same. They're going to differ because the type of things that need to be explored will be different for each time a medical problem. So you're going to have questions, but they may not necessarily be in an organized frame of thinking. So you as a group will need to look at those questions, and you will need to decide, do we need to move these questions around and answer them in a different way so that we produce a succinct and professional representation of discussion of this case. One of the most important things that we do as nurse practitioners is make sure that the information and the way that we transmit that information is done in an organized fashion to help patients and other care providers understand our view perspectives or information we're trying to get across to them. So this is one of the ways that this will be done and tested is through this discussion. I'm also asking you, based upon the content of your case study, to develop a quiz question. That quiz question I am going to use and embed in your final exam. You will need to develop a reference page with the articles, text, or websites that you used to answer the questions that are embedded in your case study. This does need to be in correct APA format, and this will be a reference page that's part of the presentation. So the formatting of your references will need to be correct. The spacing, though, we all know it's double spaced, but on the PowerPoint slide that really gets really messy and cumbersome. So for this assignment you can single space it, and you don't have to do the hanging indent. You can keep it flush left. That makes the slide look better, and I'm fine with that, and points will not be taken off for that. But the actual writing of the reference does need to be correct. So for the presentation, you are going to be asked to take all the information and place it in a PowerPoint presentation, and somebody from your group will be chosen to be the orator of it and record the information and talk about it on the slides. I provided you with two different types of videos to help you understand how do you record on a PowerPoint and then how do you upload it. For the presentation content, your first slide is going to be a brief background of your patient. The second slide will be the scenario extraction of pertinent information that helps you go into that clinical decision making for differential diagnosis. The third slide will be that differential and how your team came to that, and the fourth and remaining slides will be related to the questions that you'll be asked to answer. Remember that these questions need to be placed in a logical format of clinical reasoning and understanding for me to understand. If you want to, some of the questions you may feel are able to be grouped. And if you want to do that, you can definitely do that. And you can use any format you want. I've listed here that you can use a SOAP format if you want to, but it's completely up to you. Okay? Each CLT member on the slides needs to identify what work they did by placing their name in the lower right hand corner of the slide, size 10 font. This is my way of knowing who did the work and what type of work was done by each individual. The orator should not be responsible for making sure that all the content of the slides is appropriate and correctly done. This is each CLT member's responsibility and a professional responsibility to each other as colleagues, that you each put forth the same high quality of work as another individual in your group. On the first slide or your cover slide, the recorder replaced the following information: recorded by, and then the name of the CLT member. I'd also like to see on that slide CLT members and their group names. Make sure that you're including any relevant guideline information that you use to answer your questions. Provide a key takeaway at the end of your presentation. It could be on a final slide. Make sure you're doing the reference page and then write your quiz question. So for your quiz question, I've also provided you with a link of, okay, how do you write a quiz question? And that is located under the rubric for this assignment. At the bottom of the page here, you can see that your CLTs are listed and the type of case study that each of you is being asked to review as a group. These are really in-depth case studies for you to go into. They're good. They're going to stretch your mind. They stretched my mind as I put them together, but they're not meant to cause you to be frustrated. Their intent and purpose is to have you think and to think together as a group. So think of it as, I'm in clinic, I've got this low back pain, I'm going through it. I'm going to go consult with Kim just to make sure I'm on the right page. So that's kind of what you'll be doing in this group assignment. So I'm asking you to move out of your comfort zone. You can only grow if you're willing to feel awkward, uncomfortable when you try something new. Some of this information we're going to be learning in this particular course is complex and it makes you feel uncomfortable. But you have already got the skill sets. You've learned the skill sets. You've been working with the skill sets. Use that. You are better than you think you are with some of this more complex stuff. Take that breath. Lean back in your chair. You can do it. I'm really looking forward to working with you guys. I will see you this week online in the synchronized Zoom on Wednesday. If not, I'll be talking to you virtually. Have a great week. Questions, make sure you reach out to me.